Okay, welcome to Shrestha Vet podcast. With us here is today Dr. Torpy, and he's a small animal and exotic animal emergency veterinarian practice in Atlanta, USA. So welcome, Fred.
Thank you for having me. Yeah, I'm honored to be here.
Okay, today we invited you here to talk about the veterinary medicine practices in our country and in yours and about the academic journey. So before getting started, I'd like to know about why did you choose Nepal as a destination?
Yeah, totally. That's a good question. I think it's been in the process for a long time where, essentially I've been interested in Buddhism for a long time, mostly just the Buddhist philosophy, and the Dalai Lama has been my hero for years and years. And so I've always had an interest in learning more at some point. And just during school, my veterinary schooling, I had some personal difficulties and resolved that at some time in the future, I would make time where I went somewhere where I could focus on reflecting, learning more, contemplating. And it was important to me that wherever I went, there was some element of me giving back. So it wasn't just me going somewhere, learning, taking these ideas and hospitality, and then leaving. I wanted to make sure it was an exchange where I was also contributing. And I think Nepal has so many Tibetan refugees, and it's also just such a strong tradition in different spiritual disciplines and backgrounds, and so culturally and also environmentally diverse that all of that kind of drew me in, and I decided years ago that I wanted to come here.
We did indeed have like that diversity, but still like tolerance, like people are coming from different groups, caste, religion, but there is peace, like we understand each other. That I think that's a good part of our country. And so I'd like to know, like how did it got to connect with the veterinarians here? Like your journey was initially more inclined toward the spiritual path, but how did you get to connect with the veterinarians here?
That's also a good question. So kind of the original plan for this experience was come here to Nepal and volunteer in a monastery pretty much the whole time, where then I would be learning from the monks about meditation, contemplative practices, Buddhist philosophy. And I would also just be a bit removed where I could reflect. And then I'd be teaching English to the younger monks to help contribute. And that was the plan, and my plan was I love veterinary medicine and I'm curious about it and want to learn. So my plan was to do a week or two of volunteering, just veterinary volunteering, mostly me just kind of seeing what was going on, learning about the field over here. And then when I got here, I did a week of volunteering in a monastery teaching English, and I just saw the difficulties involved with that, where it was a wide age range, wide variability in their English proficiency. And it just seemed like it was really kind of pushing a ball up a steep hill. And there was no assurance that when I left that anybody would keep teaching them. And the older monks I talked to were pretty upfront where they said like, yep, they'll probably forget a lot of what you teach unless someone else comes. So then my friends were when I talked to all my friends about it, they were like, you idiot, like you've been spending all these years getting this expertise in this one field. You should be sharing that rather than teaching English, which is the most widely spoken language in the world. And so many Nepalis have great English and are great teachers. So then I was in touch with Dr. Bhuwan Giri, who's currently working at the Magic Marble Foundation. And I'd actually connected with him, I think about couple years ago, actually, where I just on a whim joined a Facebook group for vets abroad, mostly shelter medicine and volunteering. And I just sent him a note out of the blue, and we got in touch and we talked online. And then when I showed up here, it turns out Dr. Giri is a very charismatic vet who's got tons of friends around the whole valley. So he kind of took me on a big tour back in, I believe, early May. And I visited all these different hospitals, Animal Medical Center, Paws and Claws, Central Referral Veterinary Hospital, Sneha's Care, the shelter, a couple different shelters. And I just got to meet all these people, and I was so blown away by the warm reception I got, how open-minded these people were to someone visiting their clinics and just a stranger lingering around in their clinic, and also how open they were to ideas and wanting to learn. So that's where I kind of made the decision while I was already here in Nepal to pivot and spend the kind of the second half of my trip focused on veterinary volunteering.
Okay, that's interesting because I asked you that because normally, like you said, in our country, normally when we are thinking about volunteering, it's like developmental work or teaching English in the monastery like you did. So I was curious, like how did the journey start? Like because normally there are not people who are here. Like there are few interns coming here and practicing in certain clinics for short period of time, but yeah, there are not many volunteers here, so I was curious, and thank you. And maybe like because everybody is open towards you, I think that's because like in our country, it's more like we are treating guests as God, so it's more easier for us to open up to people. So that might be the reason. So now tell us about the experience. Like how did you felt like when you were visiting the different shelters? How was it different than that in your country? Like. In terms of like clinical practice, in terms of dealing with the clients or rescuing the animals in the shelters, how is it different?
Yeah, so I think, kind of like you were saying, I do want to emphasize how hospitable everybody's been. So I feel like it's been a huge privilege getting to be a part of all these situations and to learn and contribute. I think with the biggest differences here, and this is always just my perspective, which is one side of things, obviously, but I think veterinary medicine or medicine in general is the same everywhere, but different everywhere. And there's some major differences, but also you're seeing a lot of the same things. You're using a lot of the same tools. I guess if you were to break down the differences in the actual day-to-day, the biggest things would be different diseases, of course. That's the most obvious thing that a lot of us think about. There's more infectious diseases here and a different variety of infectious diseases. I had never seen a case of Ehrlichia or distemper or trypanosoma, or I'd never seen a lead toxicity before I came here. So, I mean, for me, those were great learning experiences. But I think that's only one part of it. I think some of the other biggest things are, of course, culturally. So there's different levels of, everywhere there's different levels of how much people consider their pets to be part of their family, what their own expectations for their responsibilities are for that animal. And here in Nepal, there's a very unique culture with the street dogs, where these dogs are living in the community, but compared to a lot of places, they're pretty well cared for, where people really take it upon themselves to say, I'm going to feed this group of dogs. And when they get sick, a lot of the time, ideally, they're bringing them in to either a shelter or a rescue group for treatment. So that's kind of this interesting population that we don't really have anything quite like that back home, of these dogs that are living on the street out kind of on their own, but they have kind of at least some level of care and a safety net. Obviously, there's a lot of difficulties with that. And that's one big difference is we do see a lot of problems related to these dogs that are just have less of a watchful eye on them. They're living outside all the time. They're living in the city, which is dangerous. They have less preventatives and things like that, or preventative medications and vaccines. So I think that's one part of it. And then also spiritually, or just people's religious beliefs. One really big difference is euthanasia is very uncommon here. Where when I worked in emergency practice, honestly, most of my shifts, I would have at least one euthanasia of a pet where there was a situation that just was untenable or wasn't tolerable for the animal, for the owners. And we'd make that decision versus here. It's pretty uncommon for the most part for people to choose that. I think it's getting more common as people get more educated or think about it more, or as beliefs change, people become more secular in some areas. But I've seen one euthanasia here in Nepal over 6 weeks of working in clinics pretty extensively, including a lot of clinics that see really pretty serious emergency cases.
So is it like more common in the States to euthanize the animal?
Yeah, so it's much more common. It's more accepted with a lot of people's religious beliefs and with people's just general values. Because there are a lot of situations in veterinary medicine where unfortunately our options are really limited for treatment, for pain control. So we do see it a lot. And that's one conversation I've had with vets that can be difficult for them to be managing these cases that they don't really have that many options to improve the animal's quality of life. And if the client is really adamant or just really isn't even considering that, I mean, that puts everybody in a difficult position. But obviously we reserve judgment, and it's when it comes down to people's beliefs, it's just that, it's their beliefs. So we do the best we can in that situation.
We can't have control over somebody else, what are their belief, that's true. So talking again about the street animal management, like in our country, like there are a few shelters taking care of the animal, but there are a lot of animals that are just open out in the streets. And like you said, like people from the community are taking care of them, like, but it's more limited to providing them food. But exactly. We are not able to give them shelter. Like even in my case, like there are 5 dogs in my community, so we are feeding them, but because of the limited space, we are not able to afford them the housing or like timely care. Like, I'm like doing the regular deworming practices, and there are many people like me who are doing the similar thing in the country. But when we think about that animal welfare, sometimes the problem is that they are just aggressive toward the people just walking by, and there are people angry, shouting all the time, why are you feeding the dogs and shit like that. So what do you think, like what can we do for the management of those dogs? Do you have any idea, like what could be a way out? Have you thought about it?
I mean, I think that, I'll just kind of go to a place of humility and say that you guys are so much more experienced with dealing with this population of animals, these challenges. I don't know how many really astute insights I can provide. I think the city's already doing a lot for population control. And if there's a smaller number of these dogs, then there's, of course, more resources can go towards that population, a higher concentration of resources. So it sounds like there's already some improvement on that front.
Yeah, compared to the past.
The volunteer groups do a really great job. It sounds like vaccination's getting more common.
Neutering campaigns are going on for the control of dog population, but that's debate. Like somebody saying, is it like we are like animal welfare perspective? Also, we are like getting not like giving them the right to procreate. So from one angle it's wrong, but from another angle it's from the management perspective it's I think it's going to one specific direction where we can manage the animal and give them better quality at the same time. So how do like the street dog are managed in the street, like in your country, in the States?
So I mean, pretty much in the States, if an animal is unowned, if it's on the streets or just living in the community, at least for dogs, typically they're very quickly brought to a shelter, and then they're treated there if they have medical conditions, and then they're kept at that shelter until they need to be rehomed,
adoption process,
or until they can be adopted. There are attempts to do that here in Nepal, but it's really difficult. Just the adoption rates are extremely low upon talking to vets here. So that's a big difficulty, versus there's a little bit more of a culture of adopting some of these dogs and really taking them under your personal responsibility back home. But I mean, there's problems with that too, and that's why there's also our main strategy is population reduction of these populations, because shelters, we do have cases where we have to euthanize animals in the shelter just because there's no more space, or there's not homes for them. So it's very difficult, and it gets very emotional. For cats, there are a lot of community cats that just live in the community. Cats are more popular in the United States, and people kind of look out for them a little bit more. There's more emotional investment, versus here in Nepal, it seems like people are much more kind of dog-oriented, and cats are slowly getting a foothold in people's hearts.
One reason for that could be like in our culture, dog is also a god. So people are more caring for dog rather than the cat, and against cat there's superstition. So maybe that's the one reason people are more inclined towards having a dog rather than a cat.
Certainly. I think there's deep-seated underpinnings, as you're saying. But then it gets really emotional with community cats, kind of just like you were saying. Some people want to remove them, some people want to spay and neuter. Most people agree that they should be spay and neutered. But then it does get really emotional. People like me, I'm a big advocate for wildlife, so I sometimes advocate for maybe more intensive population control methods, like investing more in that, trying to discourage feeding and propagation of these populations. But some people really see a lot of value in these animals. They form relationships with these animals, and interventions that disrupt their day-to-day life can be really emotional, or can be something that these people really disagree with. So it's tough. Like you were saying, you figure out the constraints with people's values, with the resources you have, and then you do your best within that. So I think
now let's move towards like the animal owned by the people, like house-owned animals. So what is the scenario over there, and how did you find it over here, like in terms of treating those animals?
Yeah, so
having ownership and straight, like there's some difference. And so how did you feel that?
Totally. I mean, I think it's kind of a similar answer of it's a lot of the same, like a lot of the same breeds over here, a lot of the same diseases we're seeing, and then there are differences. Same thing, different diseases, different levels of what the owners are willing to do as far as treatment, the amount of effort they're willing to put in, the amount of money that they have available or that they're willing to pay. But I think one of the biggest changes is just that back home we have, in America, even amongst other countries in the West, is kind of a bubble where there's so much infrastructure for veterinary medicine, for companion animals. We have I guess one of the first differences is that there's a lot of specialization. And so there's this stratification of care where you have general practitioners, and then in some areas you have emergency veterinarians who see maybe the more severe cases. And then we have all of these specialties, internal medicine specialists, surgeons, neurologists, cardiologists, dermatologists, all these topics, where this small population of cases that it's really hard to figure out if you're just seeing a lot of cases day to day for all these different topics. They get sent to these specialists to then have further guidance, further diagnostics and whatnot. Obviously, it's a small population of animals that can truly go to these specialists. There's only a few hundred of each of these specialties of people practicing them in the whole United States, over 300 million people. But I think just not only for them seeing cases, but also education-wise, we have all of these people around in the field who are so honed in on these topics, on the clinical practice of these topics, and there's so much education from these specialists. So I think kind of one of the difficulties is here in Nepal, one, you have to do everything. So
we are one and for all.
Yeah, that's like some of my talks that I've been giving to some of the local vets. That's what I tell them. I'm like, you are an emergency veterinarian. Like, there's no just general practitioners here in Nepal.
And in terms of diagnosis also, we are more like doing symptomatic diagnostics rather than like based on the laboratory practices or stuff like that, because we have limited resources. So there are a few blood tests available, x-rays, and limited stuff like MRI. I think it's still not practiced here in our country. So we are way backward in terms of resources acquisition and using that for the veterinary service. One reason might be like the affordability of our clients to pay for the service.
Totally.
So very few people are coming to the clinic. And if the cost is high, rather than treating the animal, this is like they are opting to just back out, and they're saying like we are gonna manage them at home. So that's really sad, but there's nothing much we can do at the moment. So it's a bit troublesome.
I think with that, so in the United States, I mean, like I talk about, there's that stratification where there are these specialists doing this really high-powered, really precise medicine, but then most vets are practicing, of course, with more resources, with clients who tend to be willing to spend more or have more at their disposal to spend. But I mean, a lot of vets, like I was doing emergency practice in Central Florida in a rural area for part of my shifts. Part of it was in Orlando, a big city. Part of it was an hour and a half, literally in kind of some swampy areas. And there, I mean, the diagnostics I had, I could do blood work, could do x-rays, I could do a urinalysis, had a couple other tests, parvo tests, things like that. But past that, if the clients weren't willing to go to a university or a specialty center, most of them or many of them couldn't afford it, or some of them just weren't willing to drive that far, then I was in a bit of a similar situation. And I think that it's easy to be, one, there's a lot of challenges. If you're in a resource-limited situation, if you're expected to see a wider population of cases, see all these species, then that's extremely challenging. And I want to emphasize how challenging the situation is here for the vets. But I think what I've been trying to emphasize, or at least like the small thing I've been trying to impart, is that within that symptomatic care or coming up with presumptive diagnoses instead of definitive diagnoses that we're confirming, within that there's so much you can do to improve your chances of having the correct presumptive diagnosis and to have evidence-based practice that gives your treatments the best chances of success. So that's what I've been trying to talk to a lot of the vets here about, is if you think about everything you have at your disposal, like which ways can you get information about a case and break it down into just history, doing a really good history, physical exam, doing a really good physical exam, and then blood work, x-rays. That's typically mostly what you have, urinalysis. Sometimes if it's, say, distemper or panleukopenia or parvo or something, you have some extra tests or thyroid testing or whatnot. But for the most part, you should be saying, all right, these are the resources I have. I need to get as much information as possible from these. So I think that there's a lot of that comes with education, where if say your mentor wasn't being more intentional about really being thorough with their history or doing a full physical exam every time, then it's really hard to set those habits in place. Or when all the vets around you are doing the same thing, a similar approach for all these cases and not really stepping back and re-examining quite as much, then it's hard to make those changes. All these changes take momentum, and they take people around you that you trust, guiding you, influencing you. So I think that's been my biggest emphasis, is that even with the resources they have here, it's extremely difficult. I don't want to make light of that. But there is a lot of maneuverability, and there's a lot you could do even with the resources you have to increase your chances of having an accurate presumptive diagnosis and doing strong evidence-based care to give that animal the best chance of recovering. And there's a lot of resources out there online. That's been another thing I've been trying to tell people about and show, is that there's so many free resources online from these researchers, from practitioners in other countries, to help people in situations like this. For example, there's tons of papers out there that show, for this neurologic condition, what are the most common findings, most common patient factors like age, physical exam findings, breed, predispositions, all these things showing that, all right, these are all things that you can do to statistically increase your chance if you're guessing for what neurologic conditions in front of you, because most animals in the United States also don't see MRIs that have a neurologic disease. Most of the time it is the vet making an educated guess. So using the resources you have, and then I've been saying, like, we have a saying of like leaving things on the table at the end, where things that you could have used but you didn't. So I've been telling the vets, like, don't leave anything on the table from your history, your physical exam, your blood work. Each thing, be thorough, and if you find an abnormality, if you don't know the full implications of that, then use these resources, read, and make sure that you're making the most of the information you do have.
So it's more like, rather than focusing on what we don't have, we can more emphasize on what we have and work to get the best out of it.
Exactly.
Because like you said, history can tell us, like, give us a lot of information about the background where the animals are raised, and based on the environment, we can make what could be the potential organisms they were exposed to, and aid us in the diagnosis. And like you said, like the resources that are freely available, that can be used in a lot of ways in terms of diagnosis, and also like to understand the mechanism of the disease and everything. That's a good
totally.
idea.
I think that's a really good way of putting it. Focusing on what you do have rather than what you don't have. Like, I've talked to some vets, and they say, when I go and read papers, sometimes I get discouraged because half of what they're talking about is diagnostics I just don't have, or treatments I just don't have. And that is super difficult. But kind of what I tell them is, I say, well, then ignore those parts and just really focus on what information can I get from the parts that are relevant to my own practice. And I think it's I think I try to strike a note of being encouraging, where at the end of the day, like the Nepali vets I've been working with are so smart, they're so compassionate, and they have great pattern recognition. A lot of them have such great surgical skills. They're just great vets. And I think that's what I tell them is you guys can be doing as good of medicine as even people in somewhere like the United States where we have all these resources. You can be like neurologic disease. You can be making as good of guesses as us in a lot of situations. You have a lot of the treatments that we'd be using, medical treatments we'd be using. So I think it's kind of an encouraging note of it just takes being intentional and putting in extra thought and effort and being curious, going out there, reading more, learning more. But the quality of medicine, you really can do so much in your day-to-day to really improve your chances of helping the animal in front of you. And that's not just a problem. It's not like in the United States, everybody's doing perfect histories and physicals and stuff. That's a huge problem back home too, where a lot of vets just aren't making the most of these things they have at their disposal in front of them.
I have heard about the cases of misdiagnosis too. That can happen. So
yeah, totally.
Okay.
I mean, we're always making educated guesses. It's the best we can do.
And we can from our past experience, maybe we can use that knowledge in the future to make the proper diagnosis. That could be a good way. So now let's move to the exotic animals, because we have covered the street animals and then the hormone animal. And what did you find about the exotic animals in our country? Did you get to see any of those? Or?
So I only saw a small amount, I think. I mean, there's kind of like a progression where, I mean, companion animal medicine and veterinary medicine as a whole lags behind, say, human medicine by a number of years. And then as small animals, so dog and cat medicine, other equine, other parts of the field progress, a lot of times exotic animal medicine's lagging even potentially years behind a lot of those fields. So it's always playing catch up because we're always trying to get more research for these different species and experience. But I think here it's similar, where I only saw some cases, some turtles brought in, some rabbits. But I think it's just even more so people are less willing to bring them in the first place or to allocate funds. And then also clinicians are even less comfortable with some of these species that they have less experience with because they're not seeing as many. So that hasn't been a huge part of my time here. I try to help out when I can. Usually it's just giving good husbandry recommendations. It's the biggest thing you can do in all of these cases, because so many diseases of these animals are just education and husbandry. But my goal is in the future, as I keep coming back here and volunteering, to integrate more of that.
Plans to come again. Okay, that's a good thing. Okay, one reason, if we are thinking about animal rearing in our country, we are an agricultural nation, so we have a lot of animal, but the main focus is towards domesticated animal here. Dogs and cats are they are getting momentum at the time, but it was not the case in the past. People were not open to keeping dogs inside their houses. It's normal now, we are sleeping with the dogs also, but usually in the past, people don't used to eat the food that was tossed by the dog, because there's some religious taboo with that. So it's changing, but we are changing. So the small animal, or say dog, pets and feline species, they are more reared in the cities. But if we go to the villages, there are very handful of animals that are being kept. And like you said, exotic animal is it's still a new thing for us. So one problem that I have seen is that there are few people who are even keeping lizards and python, but when it comes to treating those animals, they are more concerned, because we don't have, like you said, in the States you have more specialization, and in our country we do have specialization too, but it's more limited, not into the practice. The options for veterinarians in our country is more limited. After you complete your education, either you are working for the government as a developmental livestock development officer, or as a veterinarian. But one vet, like you said, have to deal with all those species, and it might be difficult with limited resources and a lot of pressure. So that's another problem we are facing. So now let's move towards academia. So how did you got interested in medicine, veterinary medicine?
Yeah. So, I mean, I think like the classic story of ever since I was a kid, I loved animals. I lived by some woods and grew up by some forested area and would go out back there a lot of the time. So I think that was probably a big part of me, just loving animals and nature. And then I always loved science and biology and just enjoyed reading about it, learning more about it, especially like evolutionary biology and how all these different species do the same tasks in such different ways. So comparative physiology and anatomy. And I loved learning more about that. So then I think it was kind of the perfect intersect of I got to read and learn about these things that I thought were so cool and interesting, and not only do that for my job, but use that to help animals, help people, and just really use your problem solving to directly be helping an animal and person in front of you. I think for me, that really drew me into it. And for a long time, I debated about doing research in wildlife, but I think I just really loved kind of the hands-on and also interpersonal elements of veterinary medicine.
Okay. So how is it like for other, like that's your experience, but you must have talked with your friends. How does, where they're also similar story or it's different? Like I'm asking you this because currently I'm working as a academician. So when I ask to my students, the first thing I ask in their like first class is that, what got you interested to pursue veterinary medicine? For me, like it was not because I was interested into animals or I was into welfare or any stuff like that in the beginning. Like my parents wanted to be a doctor and okay, let's do it. I had got good grades, so they were like, you should be a doctor. So I did it. And in the way, like for me, I didn't find it was for me. So I gradually shifted toward like microbiological stuff, and now I'm working in genetics. So how is it in the States? Like how do people get into vet school, and are everybody continuing the same profession, or they are divergent in the process, or how is it working?
Yeah, so I think back home we have a higher proportion of people that are interested in clinical medicine, where I don't know the exact statistics, but I would guess like 80% or more sometimes of people in a class, any given vet school class, are interested in clinical practice. And I think a lot of that's probably there's more exposure of people earlier in their life during their education to clinical practice. So either you've been bringing your animal into the vet or you worked as a technician at a clinic when you were in high school or college. And then you get that exposure and then you kind of see, all right, I think this is really cool, or I think this is something that's really meaningful to me. Same people with equine medicine, with farm animal medicine, a lot of times growing up around it. I think maybe there's just a bit more exposure versus like you were saying, I mean, a lot of clinical practice here in Nepal, at least on the veterinary side, has grown really rapidly in the last decade or two, it sounds like, talking to a lot of people. So maybe now you'll start to see more exposure of these people that like veterinarians are more visible in their life. In their close ones or in their close loved ones. And potentially there will be more of a shift, especially as the industry keeps developing and growing and improving. But I think back home it's similar where, I mean, veterinarian, you can be a veterinarian and do so many different jobs, and it's similar. And a lot of people come into school wanting to do clinical practice. They picture their neighborhood vet or the place they worked at for dogs and cats or other species. And then they realize, oh, wow, biomedical research is so interesting, or doing governmental policy or something like lab animal where you're assisting researchers, or working in production animal, but the less clinical side of it, like working for the Food and Drug Administration, inspecting meat or things like that, or doing epidemiology. So I think there's so many different careers within it. And I think that's one of the best parts of veterinary medicine is that there's so many opportunities.
You get a chance to diversify.
Yeah, exactly.
So, what about like the mentoring process? Does it happen from the very beginning you enter the vet school, or at the end of some semester, or how does it work?
Yeah.
Like in our country, if you see the academia, so after you complete your high school, so you need to clear an entrance examination, which is basically biophysics, chemistry, and English. And after you clear that, you get into vet school if you are among the top tier of the students. And afterward, like we are studying about the basic husbandry practices in the first 2 year, and afterwards gradually we start into the clinical field.
Yeah.
But when it comes to exposure, at the time we are studying, we are doing some visitation in the hospitals or farms, but the rotation system happens only at the final year of the academia, like when you complete all your education, and in the last 6 semester you do the rotation, and at that time you get to like work more closely with the mentors or the veterinarians or other any people in the field. But when students are like pursuing the study, it is more limited to one day field visit or stuff like that. So how is it over there? Like, do you guys get mentored from the very beginning, or it's something similar to us?
So, I mean, I think there's a lot of similarities, but there are some key differences. And I think that's actually one of the single biggest differences between the veterinary fields here in Nepal and back home, is that kind of, well, it's the one difference is that we do what's called undergraduate or our bachelor's, similar to you guys, but we do that for 4 years, and that's just any topic, as long as you get the prerequisite classes like biology, chemistry, genetics, certain math classes, and then you go to veterinary school. So that's usually 4 years. Then you go to veterinary school, it's another 4 years. And then at that time, it traditionally has been very similar to Nepal, where you start out learning basic physiology, anatomy, husbandry, and then they start mixing in and you learn a lot of like bacteria and viruses, the actual pathogens, but it's all very removed, and it's all very just kind of isolated on its own. And then you start to learn about disease processes, so pathology of the body and the different body systems. And then you start to learn like the ideas of clinical practice, and then you actually practice it in your clinical year. So it's very kind of like this very layered approach. But there's been a really big fundamental change back home in recent decades, especially I feel like the last 10 years, where people are saying, all right, if you're waiting until the last year or two to actually teach people what clinical medicine looks like, and then just hoping they get enough experience with these kind of random selection of experiences they might see in the clinic, then it's hard to really instill clinical reasoning during that time, a really strong habit of clinical reasoning during that short period. But then also just it's hard to integrate these different pieces of information. For example, if you learn neuroanatomy and then you learn some neurologic diseases and then you learn what it's like in practice to actually see neurologic diseases, it's hard to connect the dots between these things sometimes. Versus now they're trying to kind of integrate these things where you learn the anatomy, the diseases, and how to interact with that in practice kind of from the beginning. And that's a work in process. It's not anything that any school's perfected, but just trying to have that clinical reasoning more throughout the whole process, rather than the traditional idea was have them have a really strong theoretical knowledge base, and then on top of that, throw some reasoning on top of that for them to use it. So I think here in Nepal, the education system, like you said, it's so competitive. The students I've been interacting with are so smart, they're so sharp, and they have a strong knowledge base in a lot of these theoretical things. But then as far as clinical reasoning, as far as what these diseases actually look like when you see them, because unfortunately so many of these diseases can look so different from what they are described as in textbooks, they just have a really hard time making that jump sometimes. And then when you have a hard time making that jump, having that systematic reasoning that someone has guided you through and built that habit in you, that's where you resort to just doing the same symptomatic treatments for a lot of these very different cases. So I think part of that is, one, the schools are a lot newer, so there's just been less time for them to build these curricula. And then two, like you said, it's a developing nation that's more focused on production animals, poultry and large animals. So they just get a lot less. I've been dealing with a lot of companion animal veterinarians, dog and cat vets, and they just get a lot less education about dog and cat medicine when they're in school. So I think it's tough because they're getting less education about the species they'll be seeing. They're not getting as much guidance about clinical medicine during that time, just very theoretical. And then they get out into practice and we have these resource constraints. We have these constraints from the clients, and they have to see even more diverse case populations than many of us. So I think there's a ton of challenges with that. And that's what I've been trying to, a lot of vets can get kind of fatalistic of, well, we're not going to be getting diagnoses, so we're just doing our best. but I'm just trying to encourage people to, within the constraints you have, say, focusing on what you have in front of you, how can I get more information or be a little bit more guided with what I'm doing with what I have in front of me. So that's been my takeaway. But I think there's people like Krishna Adhikari, Dr.Shrestha here, who are really motivated to learn more about clinical practice, clinical reasoning, and they've been doing a great job getting that information, building their skills, and trying to integrate that into the curriculum. So there's already in movement. I've been really humbled that I get to contribute to what a lot of these vets are doing and offer a little bit of the expertise that I've had passed to me from the specialists, from my own reading and whatnot. So I think I'm really optimistic for the future. Like I said, these changes take momentum and they take people being intentional and putting in the time and effort. And I'm really optimistic.
I think, with time things will get better because
I think they are.
The progress we have obtained till now, it was good in the past. So slowly, gradually, people start making effort. Like you said, Krishna and Dr. Shrestha, like they are putting a lot of effort, like doing training, going to India and then coming back and teaching the students. So that was not the thing. That was when we were being educated. Like we were like bound to more to theoretical education. Like you said, we are more theory based rather than thinking from the practical perspective about diagnosis or like everything related to vet medicine. So we are more on the production side, and so there are some biases, but with time, I think like things will be better.
And so I've been optimistic. Like I've been doing talks each week for the local vets, and I've been so blown away and so moved by these vets who are so impressive, have been in practice for so long, and have so much experience, like Dr. Arjun from the Central Referral Veterinary Hospital.
They're doing a lot of cases every day.
And then Dr. Sushil from AMC. A lot of these vets who have so much more experience than me, coming in, being open-minded, being willing to learn. I make sure I come from a place of humility. I'm a younger vet, but I worked with these specialists so I can pass on the knowledge from them. Everything I try to tell is directly from research. So, but I've just been, I mean, that's not something to take for granted, that you have these older vets who are open-minded to listening to these people who are giving them some suggestions. So that's why I think I'm optimistic. It'll just take time and take some people really putting in some effort and time.
That's pretty positive. So now let's talk about like the career guidance. Like when in vet school, like where you guys counsel about the opportunities that you can explore after you complete your education? I think, I mean, it varies by school, of course, but they do a pretty good job of that. Because like I said, a lot of people don't realize all those different opportunities when they get into school, and they kind of they're made aware of more opportunities. So I think that's definitely a huge thing. That's really important because this degree that we get has so many opportunities, and it's got so much potential for different things, and making sure that everybody knows all the full options they have available. And it sounds like a lot of vets here really consider all the different options and are open-minded and do a good job about that. I was asking you because like when I'm communicating with my students, like I said, I ask them, why do you want to be a vet? And there are a lot of confusion in them. Like my parents told me I did it, somebody in my village was doing that, so I followed the footsteps. And there are a few who are more like clear about their idea, like why I wanted to be a vet. And they're also like you said, nowadays there are a lot of people who are doing like the vet tech education, like for a 3 years diploma, and then coming into the veterinary education to advance their skills. So they're more focused and directed. But there are also kids like who are just completed their high school and just following the footsteps without knowing where they are going, how are they gonna go, and they're like, we are confused, like we don't know where are we gonna go. Like in the beginning I thought it's gonna be okay, but now I'm like more doubtful, and I'm saying to them like, you don't have to limit it like just to medicine, clinical practice. There are a lot of things you can go to, but even my knowledge is limited, so I can't tell them about everything. But based on my exposure, I'm telling them like you just because you pursued a degree in veterinary medicine doesn't mean that you have to be a clinician. You can
Totally.
be a science communicator, you can be a researcher, you can do genetics, you can do pathology, and like more work on the backside where you are not directly dealing with the animals but contributing for the welfare of the animal, for the diagnosis. And in our country, like we don't have that kind of guidance. Like it's more focused toward only academia, not on the side part of the career counseling or mental counseling. So I was curious, like how does that's working?
Yeah, I think I mean, we have one advantage where we have those 4 years of schooling that we're doing before veterinary school. So that gives us time to kind of mess around and figure out exactly what we like and don't like quite as much. And I actually did about a month of a veterinary rotation during my clinical year during vet school in Germany at a veterinary college. And I saw a little bit of similar things where these students are coming out of high school. This is their first time they've ever lived away from home. This is their first time that they're in this more intensive schooling because there was a big step up in the intensity of schooling. I'm sure it's similar here.
Transition is really difficult.
Yeah, so it's this giant transition, and then you're just already in the thick of just trying to keep up with school and everything like that. And then you're expected to just figure out exactly what you want to do with your life when you're right in the middle of all that. But I think with that, I guess one good piece of advice that I got was when we go out to do some of our clinical year at other places, when we call them rotations, they're different places. If you spend 2 weeks or 3 weeks somewhere or a month to find out that you don't like something, that's time well spent. So if you are like, I don't know if I'll like clinical practice or not, then go to your local vet or approach one of these hospitals here in the Valley and say, can I spend a few weeks here trying to see what the day-to-day life is really like? If you might like biomedical research, going by CRVH, the central lab, maybe trying to spend some time there and seeing if you like it or not. Because on paper, something can sound really great and can sound like it would really mesh with what you enjoy, but then when you're in it, it might be a lot different.
That's true. Like for me, that was the case. Like I was not interested into vet med or anything. My parents were. They wanted to me and they didn't force me like to get into veterinary medicine, but when they were describing about things, I thought, oh, that's a good thing. Like I'll be a vet, I'll be doing surgery, but I didn't know about the consequences. That am I really capable of to do the dissections or to suture the animals? Because when you're really working with that, there's a lot of emotions coming out of you.
Totally.
So it can be difficult. And for me, like. When we were like caring of the animal, when we were a student, at that time I realized like this is not for me. In the middle of my academia, and then I was like, oh, what am I going to do? So I volunteer at like NARC, National Agriculture Research Center here in our country. So I was doing the microbiological work, and for me it was easier like compared to treating the animals because I'm not thinking a lot. I'm just making conclusions based on the books, doing the lab work, and I enjoyed it in the process. And then slowly, like when we are doing the phenotypic works, then I heard people doing about the molecular stuff, and I think, oh, that's interesting. Maybe I should be able to do PCR, and that's how I got into genetics. So
that's awesome.
It's very important for the students to get exposure. So. Hopefully, we can have more collaboration with other institutions in the country and abroad, where a student can get first-hand experience before really getting into the field and figure out what they really want to be. Because when we are working as a professional, it is important to enjoy what we are doing.
Totally.
It can be totally difficult when we are not part of the process. So
well, I think that's really great. And I think you guys, you're in these great positions to help coach and encourage these students and using connections to say that lab if someone's interested, trying to get them to be able to go for a couple weeks or something. So it sounds like you're doing all the right things.
Okay. So now let's conclude about veterinary experience. So what do you think that are the things that we can do better? Like you said, making available of the resources that freely available for the diagnosis can be a good thing for us. And then we are coming here and helping with the students. So that's the one exposure they get to know about the veterinary practice in the States. Plus, like the technology that you guys are using, plus like your teaching methodology, I really liked it. That was interesting because that way students will get motivated. Like when you are like really getting to know this by playing, that's a good thing. And so what do you think, like what could be reflection for us in the future to make a progression in terms of like veterinary service and academia from your exposure till that here in our country?
I think this is definitely a question that I have to approach with humility and with being cognizant of my own limitations and my perspective. I'm an outsider. I've spent the last 6 weeks almost nonstop getting more exposure and working with so many vets here in the Valley, which has been so great. And I've gotten so much great exposure, but obviously it's still a limited view. But getting to spend a day a week here at HICAS has been so amazing. But I guess kind of my humble suggestion would just be kind of some of the things I talked about of just trying earlier in education to instill this idea of clinical reasoning for the people that want to do clinical practice, trying to get them exposure earlier so they feel a little bit more comfortable with it. And then just trying to build the habit, and this is really challenging back home too, but building the habit in these students to teach them how to learn on their own, how to find resources on their own. Because that's what I tell them is like, you can have the best mentor on earth for a year, for 3 years, but then afterwards, if you don't know how to be teaching yourself, how to be finding resources that help you in the situations you haven't encountered yet, then there's still so much more you can do. So I think trying to just, think of the resources you do have in front of you. And then anytime there's an abnormality on blood work, going and reading a little bit more about it. These vets are so busy, but I tell them, don't sit and read a really long chapter about something that you won't be using as much. Take 15, 20 minutes, look at a differential list or a paper about that disease. So I think that's my biggest advice, is just instilling these good habits of trying to get the most of the information you have in front of you, and then trying to think critically, and then find the resources that can help you, because they are out there. So I try to strike an encouraging note, because I am optimistic. I tell these vets and students, you guys are so smart, you're so compassionate, you're working so hard. It's just seeking out some of these resources, and it really can make such a huge difference, even if you don't get a bunch of new resources or technology or things like that. So the hope is in the future to set up an exchange where hopefully someday I'll be a professor somewhere, and we could have students coming to the United States from Nepal, students from the United States coming to Nepal to learn, because I think the exchange could be so beneficial, and we could learn so much from each other. But I am optimistic here. Some people are already making really great changes. It's just going to take time, patience, and a lot of work and a lot of reading.
Learning is more like a continuous process, and we have to be persistent. Like only that way we can make a progression. So thank you for such a good, wonderful advices. I think student like the value, installation of the value is more important. Like if you are just focused on getting information at a time, but you are not working to enhance it, like to make it better, then that could be a problem. Because when, like you said, when you are working in the field, it's different than the textbook. So we have to be like more on the creative side, even for the diagnosis and the treatment. And sometimes like when we have limited resources, and at that time maybe we need to make utilization of the resources, what is available to us to treat the animals. So being creative, being is important, I think. So thank you so much.
Thanks for taking time.
This was a wonderful talk. So I think our students can get a lot if they can get access to the free materials, because when we are studying, we are more invested in the books that are available in the library, but that's not only the knowledge that is out there. So and with limited books, so everybody might not be able to access, but if they have got an idea about the like veterinary journals and articles that are available to them to read, so
Yeah.
I think that can be of great help.
And there's a lot of progress being made. Like the National Veterinary Council is working on getting a national subscription to EBSCO and ProQuest for veterinarians here. That has so many journals that it indexes and has access to. So I think things are moving in the right direction. The biggest thing will, just be building these good habits and then being curious and trying to keep learning more.
Like making...
Just like back home.
Yeah. So let's hope things will be better. And thank you so much for your
for
time,
having me.
for your knowledge and sharing with us about your experiences, your experience in our country, your experience abroad, and like your contribution to the animal sector. Thank you so much.
Yeah. No, it's been really great. And thank you for having me.
Thank you.
All right.